Hello everybody, so thank you for joining me today, and in today's video we're going to be looking at atrial flutter as part of the high yield ECGs edition. So just a little bit about the Medicine Guide. So the Medicine Guide is a YouTube channel with free online videos which aims to support medical students throughout their entire journey at medical school. So I've got videos on how to be successful at medical school. I've got videos focusing on how to approach CBL, PBL, teaching, histology and anatomy. I've also got videos focusing on the high yield topics that crop up in final exams, such as imaging. I've got specific videos focusing on the high yield topics which crop up very commonly in obs and gynae SBAs, paediatric SBAs, cardiology SBAs and neurology SBAs. Now this video, in conjunction with others, forms part of my high yield ECGs edition. So without further ado, let's get started. So the outline of today's video is that I'm going to discuss the risk factors of atrial flutter, and then I'll be discussing the ECG presentation, and finally the management of atrial flutter. So firstly, I'll just give you about 10 seconds to hopefully jot down a few conditions that you think are potential risk factors for a patient presenting with atrial flutter. So I'll give you 10 seconds starting from now. Okay, so we'll go through some of the risk factors now. So heart valve disease, cardiomyopathy, a PE, pneumothorax, alcohol abuse, and also caffeine misuse. Okay, so this is a very classic presentation of atrial flutter on an ECG. So I'll give you 10 seconds to identify some of the classical features that you can see on this ECG, and we'll discuss in a bit more detail. Okay, so let's talk about this ECG in a bit more detail. So one of the key characteristic features of atrial flutter on an ECG is the presence of a sawtooth appearance or flutter waves. Now these two terms are used interchangeably. So if you have a look at the diagram on the far below, hopefully you'll appreciate that this ECG does have a sawtooth appearance, or like I said, you can call it flutter waves. Another key feature is the fact that there is a narrow QRS complex on the ECG. So if you have a look at the QRS complex encircled with the blue circle, hopefully you'll appreciate that the QRS complex is very narrow here. So those are the two very classic features of atrial flutter on an ECG, and this ECG is something that they can quite easily throw into the knowledge paper exam, and also as part of your OSCE station if you have an OSCE station focusing on ECGs. So just be aware of these two key features, and hopefully you'll be in a better position for your exams. And finally, one key piece of information to remember, more so for your knowledge exams, is that the sawtooth appearance or the flutter waves are more prominent or are more visible following a carotid sinus massage or IV adenosine, and that's something that's very important. Okay, so looking at this slide, all of the different ECGs, hopefully you'll appreciate, are examples of atrial flutter. But these are all examples of atrial flutter with various degree of AV block. So I'll give you 10 seconds to identify the nature of the AV block on the first ECG in the far left hand corner. Okay, and I'll give you 10 seconds starting from now. Okay, so let's go through the answers now. So this is an example of atrial flutter with a 2-to-1 block. So for every QRS complex, there are 2 flutter waves present, and hopefully you can appreciate that because they've been encircled in this red circle. So I'll give you another 10 seconds to find out the type of AV block that's present in the middle ECG. So the example in the middle is an example of 3:1 block. So in this QRS complex, hopefully you can see that there are 3 flutter waves present after each QRS, and I do understand that if the ECG was perhaps a bit longer, you'd be able to see the 3rd flutter wave after the 2nd QRS complex. And again, if you just have a look at the ECG on the far right hand corner and just focus on the 1st QRS complex, I just want you to use that as your starting base to help identify the type of AV block that's found in this ECG. So I'll give you 10 seconds starting from now. So this is an example of atrial flutter with a 4:1 block because there are 4 flutter waves present after each QRS complex. Okay, and hopefully you should feel a little bit more confident in interpreting atrial flutter and also identifying the type of AV block that's present, because this is something that they could quite easily throw into your knowledge paper exam. Now, focusing on the management, we've got 3 possible methods of managing atrial flutter. So the initial management of atrial flutter would involve anticoagulation and then direct cardioversion with synchronized shock, and this is performed to help restore the sinus rhythm. Now, if the direct cardioversion was unsuccessful, or if we have maintained sinus rhythm after successfully cardioverting these patients, then we would need to consider medical management like digoxin, verapamil, diltiazem, or beta blocker. Now, the definitive treatment of atrial flutter is to offer radiofrequency ablation. We can also offer radiofrequency ablation in patients where cardioversion has been unsuccessful or if the atrial flutter is still recurrent. So this, I would say, is important to be aware of and to be familiar of, but I would say interpreting the ECG of a patient presenting with atrial flutter and being able to identify the type of AV block is more high yield in medical school final exams. However, I do think the management of atrial flutter is something that they could quite easily ask you as the special question in an OSCE, so I would say just be familiar with the management plan of atrial flutter, but the key thing to remember in terms of the topic of atrial flutter is being able to interpret the ECG and also being confident in terms of interpreting the type of AV block that's occurring in a patient presenting with atrial flutter. Okay? So this marks the end of my video today. Hopefully you found it useful. If you have found it useful and you've enjoyed my video, please could I kindly ask you to give me a thumbs up, subscribe to my YouTube channel, and also share this channel with your friends. Please could I also ask you to kindly post in the comment section below, and hopefully we can create a nice community where we can all support each other and help each other get through our exams. So thank you for watching my video today, and I wish you all the best with your final exam.